welcome Ms. Ramsey Jackson from the Ministry of Justice. Beside her, the medical officer, Dr. Marion Bullock-Ducasse. Senior? Yes. Chief Medical Officer. Thank you. Dr. Ducasse, our Minister of Information, Senator Sandra Faulkner, Minister Ferguson, Minister of Health, and beside him is the Permanent Secretary, Dr. Harvey, the Permanent Secretary in the Ministry of Health. I'm now going to turn things over to Minister Faulkner. She will update us on some of the decisions coming out of Cabinet. Then we will hear a short overview from Minister Ferguson, and we will then open the briefing for questions and answers.
Thank you, Lincoln.
At this time, Minister Faulkner.
Thank you, Lincoln. Well, before I start, good morning, everyone. Thank you for coming. We want to thank our viewers on the PBCJ and those joining us on the World Wide Web. Before I go into my briefs, just want to say a big hello to all our teachers in Jamaica. Today is Teachers' Day, and just to say how much we thank you for the work that you do for our country. Cabinet has approved a special benefit order for the National Housing Trust's Balaclava Housing Development in St. Elizabeth. Drafting instructions have also been issued to the Chief Parliamentary Council in order to facilitate promulgation of the special benefit order. The special benefit order became effective on April 26 this year. Under the order, 28 housing solutions in the scheme will be made available to NHT contributors who are public sector workers, senior citizens, young adults, and persons with disabilities. Contributors who benefit under these special benefit orders are required to meet the basic criteria regarding the number of contributions and the minimum number of points under the Priority Entitlement Index. The Balaclava housing development is situated on a 52-acre property. It comprises 112 serviced lots, including 109 residential lots, 3 agricultural lots, a green area, a playfield, community recreational area, infiltration ponds, and a buffer zone. The solutions are now ready for sale. Cabinet has approved the issuing of drafting instructions for the reform of plea bargains and negotiations under the Criminal Justice Plea Negotiations and Agreements Act 2005. Although promulgated in 2005, plea negotiations have hardly been used. Only 10 agreements have gone before the courts since the amendment to the Act in 2010. The plea bargaining system has proved to be an effective mechanism for securing convictions in other jurisdictions and could prove an important law enforcement tool in Jamaica. The latest reform measures proposed include designation of plea judges in both the Supreme and Resident Magistrates Courts, post-sentencing plea negotiations where a prisoner who is serving a term wishes to assist the prosecution and in doing so may have his or her sentence reduced. Cabinet has approved the visit of a Jamaican delegation headed by Finance and Planning Minister Dr. the Honorable Peter Phillips to Canada. The team will participate in a series of meetings with the Canadian government between Jamaica and Canada and to discuss ways in which the Canadian government could assist Jamaica's efforts to reform the economy. Minister Phillips will be accompanied by Financial Secretary Mr. Devon Rowe, Bank of Jamaica Governor Mr. Brian Winter, and Ms. Helen McIntosh, Technical Advisor to the Minister. They will visit Toronto and Ottawa. The cost of the visit is approximately $2.5 million. Cabinet has approved the appointment of a new council for the Institute of Jamaica. The council will be chaired by Ambassador the Honorable Burchell Whiteman, and the vice chairs are Professor Rupert Lewis and Dr. Suzanne Francis Brown. The Most Honorable Edward Siaga, Professor George Lamming, Professor Gerald Layla, and the Honorable Barbara Gludon, as well as Professor Sir Roy Auger, will serve as Fellows of the Council. The Institute of Jamaica was incorporated in 1879 for the encouragement of literature, science, and art. It became a statutory organization in 1978 and is currently charged with researching, encouraging, and developing culture, science, and history, as well as the collection and preservation of cultural, scientific, and historical works, illustrations, and artifacts. The new council will serve for 3 years. The members of the Cannabis Licensing Authority have been approved by the Cabinet. Its chair is Dr. Andre Gordon. Other members are Mr. Dermot Spence, Dr. Winston Delahaye, Dr. Conrad Douglas, Ms. Diane Edwards, Dr. Eileen Boxill, retired Major Gregory Webster, Professor Errol Morrison, Ms. Shona Trowers, Ms. Michelle Walker, Professor Wendell Abel, Dr. Kathy Ann Brown, Professor Archibald MacDonald, Mr. Orville Silvero, Mr. Verald Vassell, Mr. Gregory Mogg, and Mr. Jason Hensel. The chairman of the National Council on Drug Abuse is an ex officio member of the authority. Appointment of the Cannabis Licensing Authority follows amendments to the Dangerous Drugs Act, which provides for the establishment of a lawful, regulated hemp and medical ganja industry in Jamaica. The authority will be responsible for making regulations which are subject to the approval of the Justice Minister for the issuing of licenses, permits, and authorizations for the handling of ganja and hemp for medical, therapeutic, or scientific purposes. The authority is mandated to ensure that the regulations do not contravene Jamaica's international obligations. And Cabinet has approved the appointment of new boards for the Planning Institute of Jamaica and the Students' Loan Bureau. The PIOJ board is chaired by Director General Mr. Colin Bullock and includes Professor Alvin Wint, Dr. Ike Johnson, Mr. Robert Winter, Dr. Pauline Knight, Dr. Joy Moncrief, and Mr. Everton McFarlane. The Students' Loan Bureau will be chaired by Mr. Gladstone Tony Lewars, and Mr. Casey Bourne is Deputy Chairman. Both boards will serve for 3 years to March 2018. And as Lincoln said before, we have with us this morning the Minister of Health, the Honorable Dr. Fenton Ferguson, who made his presentation to the sectoral debate yesterday. He will give a brief statement, after which we will take your questions. We also have Mrs. Luciana Jackson. She is Senior Assistant Director of the Legal Reform Department in the Ministry of Justice, and she will answer any questions you have on the reform of the laws relating to plea bargain and negotiations. Dr. Ferguson, you will make a brief statement now.
Thank you, Minister. Morning, everyone. I too would want to join you in wishing the teachers of Jamaica happy Teachers' Day. I want to thank members of the press for your continued support of the work of the Ministry of Health. Yesterday, I made my contribution to the sectoral debate and want to use this opportunity today to expand on a few things that I mentioned and speak to other issues that I was not able to discuss in detail. I indicated in Parliament that the regional health authorities must be up to date with the payment of deductions for staff. I understand the issues and empathize with staff members who are faced with this challenge. I have discussed the matter with the board chairman and have been assured that they are working to ensure that payments are consistently made on time. The Southeast Regional Health Authority has made payment up to March 2015, and the board chairman has assured me that the region is moving with alacrity to make payments up to May and thereafter keep up to date with the payments of deductions. I want to thank Chairman Dr. Carl Bruce and members of the task force that was established to develop recommendations as to the feasibility of an approach and design of revised working hours for physicians in the public health sector for the work that they have been doing. As I said yesterday, we do not intend to implement a shift system for doctors until we have fully discussed the matter and reviewed all the recommendations from the task force. I want to stress, however, that we simply cannot continue with the present situation, and so there has to be a change in the future. As a part of the health team, I do understand the issues surrounding remuneration, and I have long said that doctors must negotiate a livable wage, especially when you consider loans, mortgages, pension, and retirement. We are also concerned about the long hours of work by physicians as this threatens patient safety and physician well-being. I look forward to the engagement of all the groups towards an amicable and mutually beneficial solution. While we continue to make improvement to the health sector, customer service remains an area of great concern. We keep hearing about negative experiences from both sides, the clients and the healthcare workers. As a healthcare worker, I'm very disappointed when I hear of any ill treatment meted out to patients and their families, because certainly many of us took an oath that bind us to upholding certain ethical standards. So anything less is simply unacceptable. The ministry has drafted a customer care policy in which there will be sanctions for breaches. We'll start consultation with health groups and other stakeholders in this financial year. Equally unacceptable is the treatment of our healthcare workers by members of the public. We will not put up with it. I want persons to know that if they assault any of our workers, we will not hesitate to call the police and deal with the matter to the full extent of the law. Medical missions. This morning I attended the opening ceremony for the United States naval ship Comfort, which arrived in Jamaica Tuesday morning and will be here until May 15, 2015. The ministry began screening candidates for surgery yesterday at the Kingston Public Hospital and the Bustamante Hospital for Children for patients previously selected and who meet the screening criteria. Surgeries will be done aboard the ship. It is expected that approximately 800 patients will be seen each day at the two medical outreach sites at the National Arena Complex and the Maxfield Park Health Center. Services to be offered include optometry, dentistry, general medicine, women's health, pediatrics, and the pharmacy. I urge Jamaicans to come out and take advantage of this opportunity. Later this month, we will be hosting another mission, this time out of China. While in Jamaica, the Bright Journey Cataract Mission will conduct a cataract surgery clinic at the Kingston Public Hospital from May 18th to 29, 2015. The mission expects to see about 200 patients. I want to use this opportunity to thank all our partners in the diaspora and elsewhere who have continued to support us through medical missions and voluntary outreach. During 2014, we hosted a total of 184 diaspora groups, which visited Jamaica to offer services including general medicine, optometry, dentistry, and ophthalmology, among other areas. In 2013, we had approximately 200 groups, and in 2012, we hosted 172 groups. As I indicated yesterday, we are on a steady path to developing the health sector. We are built on the solid foundation and will continue to put systems in place to improve the way we deliver healthcare in the public sector. I believe if we continue along these lines and with the support of all stakeholders, we will be well on our way to achieving our health goals outlined in the National Development Plan, Vision 2030, which speaks to a healthy and stable society.
Thank you, Dr. Ferguson. We now open the floor to questions. And you remember the rules, one and a follow-up, and if we have time, we will take others after. Darren Luton. A microphone for Darren, please.
Thank you. Morning. Morning, Minister. Morning.
Turn it on. Can we get some sound,
It's
please?
on.
Okay.
Yeah, thank you. Minister, the audit that you have ordered with respect to the regional health authorities, have you come to the point where you have looked at whether the decentralization is working? Isn't it the case that these authorities are out there on a frolic of their own, and perhaps having centralization would be a better policy in terms of managing the health sector?
Certainly not. I think before we got to regionalization in 1997, we had a central operation. After 18 years, absolutely there would be issues relative to the regional authorities. The last major report was done in 2008. Professor Winter Davidson had done a report on these regional authorities. We believe that the Health Services Act is very clear as to how they should operate. At this point, I believe they are at their most united position because the 4 chairmen of those authorities now meet almost bi-weekly, and there has been continuous meeting between myself and the authorities. Part of it to ensure that we are on the same, and they are on the same playing field. There are issues about regionalism that we believe over time, in terms of the health reform, looking at the human resource aspects within the authorities, whether there's any type of overlap, greater efficiencies, I believe, within the system could make a difference, and we have started in that regards.
May I follow, Minister?
Sure.
Can you just indicate the audits? When are the chairmen supposed to report to you and start implementing in terms of managing properly the resources they have? And with regards to the task force looking at the hours of work for doctors, why were you pushing ahead to implement the 40-hour work week without having a task force look at something like this? Were you putting the cart before the horse, so to speak, in this regard?
We know of no pushing forward. When, and the permanent secretary would be better able to speak to that, but it was from the letter I had, there was some discussions about looking at implementing this during the new financial year, which would have started in April 1st. Dr. Dawes wrote to me, I think it was on the 23rd of February, stating that if there's any contemplation about April, it would not be feasible. He would not recommend that. And therefore, he was the one who put on the table about July. As far as we are concerned, and the discussions with my permanent secretary, the task force was set up to look at the pros and cons of any kind of flexi hours or shift system. It was never contemplated that before that work was completed, we would be implementing anything. That is where you'd talk about putting the cart before the horse. Our intention, and as I stated yesterday, is not a new position, that we will not implement any system until we have completed the work of the task force. That task force, part of its mandate now, and they are the ones under the chairmanship of Carl Bruce, that have put in place 2 subcommittees. One, to look at other jurisdictions, to look at best practices. 2, to look at what would be the impact on doctors in terms of salary if we had to implement such a system. And that work has started in earnest. The PS would be better able to respond to. The audit, they would have started now. I would believe that within 3 to 4 weeks, I should be getting back, if it's even preliminary, because we expect that with the increases in budget, while we don't believe that $7.2 billion increase is a panacea in terms of solving all the problems, we believe it is a step in the right direction. And therefore, there are some areas that we believe we will be able to do better. They talk, persons talk about equipment being down, issues of maintenance. Last year we had a maintenance budget of 80 million. This year it is close to 500 million. We have spoken in the past about health promotion and prevention and that kind of thing. Last year we had a budget of 20 million. This year we have a budget of 271 million. So there are areas that we know we will be able to do better than we have done in the past. But I'll ask the permanent secretary relative to the expectations of the task force.
Right. We have not given the task force a specific deadline at this time, but because it will be determined by how the group work and the kinds of information they need to put together to come up with the appropriate recommendations. It would have been folly for us to have established a task force to review a matter and make a recommendation, and then we implement something before the recommendations of the task force. In fact, what would we have implemented? Because there would have not been anything to implement, because we would have not had a design or a working out of a shift system to implement. So there was no possibility or feasibility of implementing a shift system before we had a documented position as to how a shift system could work in the current state of the health sector. So I think the actions of the JMD was really premature and not properly thought out in terms of the actions that they took. And I know they're going back to look at the task force to see how they can make their input to ensure that what comes out of it is the best for everyone. Just to say on the issue of the decentralization quickly, that despite the fact that we have decentralization, there are still some things that we manage centrally. And for example, the procurement of drugs in the main is managed centrally through support from the National Health Fund. And we're looking now at some of the maintenance of equipment, particularly our more complicated equipment such as MRIs and CTs, because we have so few of them, to look at a national mechanism of maintaining those equipment.
Do we have any other question? Abco.
Good morning. Abco Fitzhenley, Nationwide News. Question to Dr. Ferguson. Good morning to you, sir. The audit which you have directed be conducted, can you give me an idea why you have so done first? That's the first question.
I have, even before there was intense discussions in the media, we recognize that we have over 300 health centers. We have 24 hospitals. On any given day, we get complaints coming. We have had complaints coming from the media in terms of persons going into institutions. We have had complaints coming from clients, etc. What this is about is going in, doing your audit, so that what you could consider things that people that could create a misery for our own clients and our workers, because whenever we do anything better, whether it is infrastructure or otherwise, both the clients and the workers benefit from these decisions. There have been accusations made in recent time in the discourse with the medical doctors, and it was, and I felt after consultation, that it made good sense, and with the additional funding that we have had, that we make sure to do this kind of audit, especially not all institutions, but your most critical ones, because so that at least we would be able to respond as best as we can, given the resources that are with us this year.
Okay, I asked the question against the background that my perception certainly is that the problems facing the sector are well documented. Yes, we know what the problems are, the severe resource constraints. I wondered why an audit, why not just proceed with finding a solution to what we already know the problem is?
Well, I'm sure you wouldn't believe that we have stopped working while all this audit or whatever is taking place. We have had, over time, there are some institutions that have consistently been in the news from time to time, and to that extent, when there are issues such as that, we are outside of having issues. That is why you have a regional technical director. That is why you have a regional director. That is why you have a permanent secretary and a chief medical officer in the ministry. So it is work in progress. So it is not a stop and see what the audit is going to say for us to continue to work. Last year we had issues about elevators at KPH that don't require audit. We know that the elevators were down. We have now, elevator 1 is back up. Elevator 3 is now ready to be commissioned. And I've been told within the next 6 weeks, well, possibly about 5 weeks' time, we should have elevator 4 ready and up. We remember very well how strident the criticisms were when the elevators were down. I don't hear any praise about the elevators being back in service now, and surgery can take place as we expect.
All right, thank you. The shift system, Minister Ferguson, when do you expect to be in a position to make a definitive call regarding whether you're going with it or not?
After we have received the task force report.
When do you anticipate receiving that?
I think the permanent secretary just answered that question. So I don't know if it is for the record coming from Nationwide, but the permanent secretary just answered that.
Abko, you have another question?
Well, I'll defer to my colleagues. I have others, but I'll wait.
Okay. Do we have any other questions? Who, Nico, you have a question?
Warren Bertram, RJR. My question is another matter. I want to find out from the health ministry, have any persons turned in any medical bills stemming from the Riverton fire?
Repeat.
Has anyone turned in any medical bills to the health ministry for the Riverton fire?
Well, put it this way, I know not of it. What we know is that we have, during that period, we responded in a number of institutions within the corporate area and St. Catherine to persons who were impacted, most of whom had issues related to respiratory type illnesses, and from the reports we have had, we were able to treat those persons who came to our facility.
The reason I asked the question is yesterday the local government ministry had stated what it had costed the NSWMA, and it was raised about the medical bills. And the permanent secretary in the local government ministry had said that any medical bills that would have stemmed from persons being affected by Riverton fire would have gone to the...
Okay. I think a similar type question was raised in Parliament yesterday. And basically what it is asking for, is to look at what would have been the impact on the health sector in terms of cost to the health sector. Because we had to extend having health centers open on the weekends during that time, which is a cost to God. And I have given a commitment to Parliament to have something and to report to Parliament on it. So you will get that.
Nika, you have a question? Okay, Nika.
I have several questions. Hello?
We can hear you, just project.
Okay. Good morning, everyone. Nika Lewis from CVM News. I have several questions. I'm trying to do the triage.
Well, we ask you to do the one, then the follow-up, so we can give your other colleagues, and then if we have time, we'll come back.
Okay, sure. This question is from one of my colleagues to the Minister Ferguson. How do you feel about the JMDA divulging such sensitive details regarding the shortages in the ministry that's affecting
Nika,
your workers?
Sorry to interrupt. Can we give Nika a mic that works? We're not hearing her well at all. Oh, it's working now. Yes, go ahead.
Thank you. Okay. All right. The question is to the Minister of Health, Minister Ferguson. How do you feel about the kind of information that was revealed by the JMDA recently regarding the shortages? And also, we are aware that there is fiscal concern at this time, and we know that you have to budget additional money for this. How will this affect the health ministry in the long term?
All right. In relation to what the Jamaica medical doctors spoke about, which also will form a part of the audit, because the veracity of some of the things, certainly I know I have sent the chairman of the Southeast Regional Health Authority to visit institution. I know he has already visited Spanish Town Hospital, and I've met with the leadership of that hospital on some of the things that were said. And but some of the things we have never, and I have never as minister, come to the country to say that the health sector is perfect. We have always said it is a challenging ministry with issues. There are times when there's shortage in one health center, not because there's shortage in the ministry or the region, but a matter of inventory and distribution. There are issues of management that arise from time to time also. The issues of the health sector, and let us be very frank, ladies and gentlemen, the issues of the health sector is not one that is a 2015 thing. It has been over a protracted period. Sometimes out of frustration, even us as a country, we say Jamaica is the worst thing, and it's not true, because health is one of the few ministries, our portfolio, that can demonstrate by way of outcome what it is that we have gotten, even with the limited spend for health. Persons' average life expectancy is 74, moving from 47 years ago. We have one of the best immunization system in the Caribbean and beyond. Over 92, over 90%. And we have had many other things that we can, Jamaica, some developing countries are now experimenting with primary care systems and centers of excellence. We are ahead into those things. But we do have low-hanging things that from time to time have really worked against us. This year, I have given a charge to the regional authority. We have had discussions with my permanent secretary, with my chief medical officer, that we must deal with those simple things that are mitigating against our clients. And that is why our expectations, while we accept that there will still be issues going forward, that there are some low-hanging fruits that we believe with this increased budget this year we'll be able to deal with it.
Thank you.
You have a follow-up? All right. Do we have anybody else? All right, we go Darren, then we take one more from Darren, we take one from APCO.
Thank you again, Minister. Minister Ferguson, I realize I didn't hear you touching on the issue of the fast food and sodas. You touched that, I think, a year or 2 years ago.
Yes.
Have you abandoned that as it relates to the fight against NCDs? And also, since it's my last question, I won't go further than to ask how long will health care be a part of our landscape? Yesterday you said it's not going to go now. How long will it be?
All right. The fast food industry, I have engaged the fast food industry during, are they more powerful than tobacco? I have engaged the fast food industry. We have had discussions. We are in the process now of putting in place a task force to look at the industry generally speaking. I have engaged them relative to say, at a minimum, we must start looking at label for our products. We must start looking at ingredients in relation to what our people are having. We must start looking at caloric value going forward. Even as from the consultations that we did 9 consultations across the country. There was loud sounds about putting a cess on the industry. We have not come to that position. We believe that there are some simple things that should be done. First, and secondly, we have just launched our dietary guidelines relative to food as part of, because there are 4 critical risk factors: unhealthy food, tobacco use, abuse of alcohol, and physical inactivity. And we are dealing with them one by one. Not one by one in terms of piecemeal. We are doing all 4, because we are also guidelines for physical activity that came out a couple months ago.
Sure, sure.
Because you mentioned alcohol in that. Is it that you will also be having a sort of a program or a project where you'll be looking specifically at regulating the alcohol sector too? We
are going to, and we have started, I know I've met with the chairman of, is it Reneville? Biles?
Yeah, no,
Yes.
he's Red Stripe.
Red Stripe, yes. But we're going to continue the dialogue, because alcohol is not about saying people mustn't drink. What we're talking about is abuse of alcohol, which the back end of which is domestic violence, the back end of which is motor vehicle crashes, the back end of which is many of our best people in the most productive years becoming alcohols. Those are the issues. It's not about anything to say. The one we have been most strident has to do with tobacco, because we have seen clearly 70% of the lung cancer cases at the National Chest Hospital directly related to tobacco use. And 90% of all the lung cancer cases there are chronic smokers. So we have good evidence about that. But we feel if we are able to deal with these risk factors while we are spending money on the curative side, we believe over time we could significant. That is why the promotion and prevention budget has moved from 20 to $271 million this year.
The free health care.
Free health care, only last week we had a 2-day conference. I'm sorry I didn't see many members of the press, but 2-day conference on universal access and universal health coverage. The intention of which is over time, we are working to develop a roadmap and to determine over time what strategy will emerge, whether it is a national health insurance or otherwise, that will allow for persons not paying at point of service, because that was part of the big issue even with the user fees. Persons coming in sick, faced with having to do what you call it, not the screening, the appraisal to determine whether you fall below poverty line or that kind of. We are saying no. We believe that in 2008, when the process was liberalized, that it was a bad decision in terms of removal of user fees. But relative to where we are now, we're still having the impact of that. But we believe that going back to user fees is not the way at this time.
Abco?
Minister, taking into consideration the whole Chick-V crisis that gripped the country last year,
Yes.
and the chronic state of affairs affecting portions of the sector over which you supervise, and I'm not being splenetic, there are some of us who genuinely feel that you have underperformed in your portfolio, and really that you're lucky to still be in the cabinet.
Yes.
How do you respond to that sort of criticism? How do you genuinely assess your performance? I want you to level with me.
I believe that, and I'm not surprised that this has come from you. It's the second time. I've kept a note of it. The fact is, judge me not on Chick-V, that you and others have kept going back to. It was the Americas that was impacted by Chick-V, not Jamaica alone. Go and talk to other jurisdictions relative. They were asked in Jamaica for guidance and help even as we had our challenge. The fact is, and I said in my presentation yesterday, I continue to be sympathetic to those who were impacted. I have also said for persons who had chronic diseases that they would have been the ones to suffer even longer. That is the diabetes, high blood pressure, sickle cell, etc. But let us look quickly. Since 2012, we have spent over $1.5 billion fixing up hospitals and dealing with critical pieces of equipment. We have, since that time, taken up work started in the last administration. We are now 128 health centers in terms of either building or refurbishing. And we now have about 7 or 8 that is ongoing. We have established 4 centers of excellence one in each health authority. Never before, first time. First time in the history of Jamaica. We have brought to bear the tobacco control regulations. Jamaica was signatory from 2003. Successive ministers have attempted. We have put that in place. Wasn't simple, wasn't easy. Some of the licks I'm getting now and I'm not afraid to say that in every country where tobacco regulations have come, there has been, in whatever shape or form, those ministers have come under significant pressure. I am saying to you, as one who is also a scientist, let us look at the evidence. Compare me with ministers before relative to what I have done during my tenure. Yesterday we signed a contract for $14.4 million US for 2 linear accelerator machines, the biggest investment in the health sector for equipment in the history of this country. What will that do? That will bring the cost of radiation treatment, that is now 1 machine like that in the private sector, from $1.8 million to 0 for the most vulnerable. That I regard as some major achievement. It's not about me, it is about a team. It was the same team that was there, many of those persons before my time. So to argue about being out of, and the Ministry of Health is not my first assignment as minister, first as a senior minister, but I've worked in education, agriculture, transport and works, and in every ministry that I've worked, I've left behind a positive reputation of work. What we have is a conspiracy. I'll say that, and I say it without reservation. Every time you talk, people go back to Chick V. You cannot define my period as Minister of Health on the basis of Chick V alone. It would be unfair, I believe, relative to all that we have done since 2012 and accomplished. And the records are there to compare with any other epoch. Go to Washington and talk to the Powell. Go to Geneva and talk to WHO. Go to the Global Fund, for which I'm an alternate member for Latin America and the Caribbean, and ask them about Jamaica's performance in the last few years in the area of health.
You see,
and
Minister,
you will get the
I hear you, but when, for example, we have reports, and there's a perception that are more frequent of late of, persons suffering in hospitals for lack of care. We hear about the dilapidated conditions. We hear about the doctors using scandal bags in the theaters.
doctors or one doctor?
Well, doctors. The JMDA boss, he speaks for the constituent of doctors. And when we hear those reports, there's a perception that things are perhaps getting worse, and therefore
Have you
ask
seen?
the question of what
Yes,
you're doing
but,
about it.
but let me ask you, have you looked at one document we put out yesterday? Have you read my presentation or listened to it?
I listened to it in full, sir.
Okay. But I would like for you to, and I'm going to do some other things relative to the whole giving further evidence to what we have achieved. Because, the truth is, yes, you're going to get some complaints. They're going to come, no matter who becomes the minister. Health in any country is one of the most difficult portfolios. And more so when you have the kind of network of health centers and hospitals within a country our size, you are going to get complaints. So if it is on the basis, have you heard any of the good news about health that you could use as a counter, like somebody talking from the Center of Excellence in Hampton Court, or the Center of Excellence in Santa Cruz, where we now have a electronic patient administration system between Santa Cruz and Darlington Center of Excellence. 13,000 patients already on working towards electronic medical records, you need to get some of the good news too. You know, to balance all of that negativity that you seem to have an affinity for.
Question, and boy, you've gotten a lot of latitude.
No, but he said something.
No, give him all of that.
No, man, I'm giving him and
all the latitude.
Dr. Dukas just wants to say something in reference to your last question, if you'll just allow her, and then we'll
Sure. Please go ahead, Dr. Dukas.
Okay. I wanted to just urge that we introduce some balance in terms of our statements and how we view the health sector. Our core functions, as you all know, it's a technical ministry, and of course quality of care is our priority. I think most persons are not aware of the large numbers of successful visits that take place in our health facilities each year. And Minister spoke to it in his presentation yesterday in the sectoral debate. The fact that there are over 1,600,000 successful visits into our primary care health centers, and also that well over 60,000 successful surgeries have taken place. The fact is, when complaints are made at a local level, we allow the local teams to do their investigation, and then we take those reports, of course, while we're taking any corrective actions to ensure that we have the relevant supplies on the ground. So some of what you have heard in terms of the shortages, we are doing the necessary investigations, and we are ensuring on a day-to-day basis that where the shortages occur, that the gaps can be closed, and we are at present awaiting reports, as the Minister has said. Checks are being made now, and the system, of course, is accustomed on a daily basis to be responsive to the shortages. Where there are gaps, we work towards closing them. And we do encourage our healthcare workers to make known exactly what their challenges are, and also how we can arrive at solutions. But we do ask for some balance in terms of when persons speak to shortages, that we do ensure that we have all of the information, and the ministry, as always, will make this known and let you know what the solutions are.
Okay. Dr. Ferguson, in relation to something you said earlier, you know, when the no smoking ban put in place, there are persons who commended you for that. We cover that when, for example, mechanisms put in. I did. I wrote the story personally.
I've never heard that.
When.
So you're
he's now commending you.
When, for example,
we
mechanisms
put that on the
put in
record
place
now.
to make free cancer treatment, radiation, that sort of thing. We cover that, but so I really reject the view that the media is focusing on the negative. But the question is
I
this.
didn't say the media. I didn't say the media.
You had spoken to a conspiracy earlier. The perpetrators of that are who?
And that's your.
I won't respond to that. I won't respond to
Well,
that.
it's a serious comment you're making, so I suggest it demands a response.
I know.
All right, we'll take the final question. Nico, final question is yours. Thank you, Abka.
Are you hearing me?
Yes, loud and clear.
Okay. Do you plan to intervene in the alleged fallout between the permanent secretary and the JMDA at this point, Mr. Minister?
Didn't you respond to it?
I responded yesterday, and I noted that cleverly the press this morning tried to give the impression that I was out of the loop because Dr. Harvey and Dr. Dawes had made up, and based on in my statement in Parliament, I spoke to the fact that I'm aware that Dr. Harvey had a meeting with the health group, and that Dr. Dawes had apologized and had said that he would yesterday apologize publicly. From all indications, Dr. Harvey has put his position in the public space.
Absolutely.
And I think Dr. Dawes has also done so not in terms of the apology, but has made a comment yesterday. Our expectations is that the task force work will continue, and our own expectations is that the JMDA will be back at the table.
Thank you, Nico. Thank you, ladies and gentlemen of the press, and we want to thank our guests this morning.
Just
Dr.
yes,
Harvey wants to say something before we wrap.
I just wanted to clarify quickly that the statement by the JMDA, which referred to me, and the fact that we, had resolved the issues, was not a joint statement at all in any way, and it was a statement solely from the JMDA, and in fact, it is a little bit contrary to what we had discussed and agreed in terms of the JMDA issuing a formal apology. The president of the JMDA, in the meeting we had, apologized for his statements towards me in front of all his senior colleagues and agreed in that meeting that he would have issued an apology publicly the next day. What he released was not quite an apology, but I have no intention of revisiting that issue any further, and we look forward to working with the JMDA and all the groups to have these issues resolved. We have to make our conscience guide us in how we proceed.
It is actually with the Governor General. The board is appointed by the Governor General, the PBCJ board. No, not really, no. The last board came to an end, I believe, in either March or April, and the Governor General, I've spoken to the Governor General, and I know he has sent out to the Prime Minister and the Leader of the Opposition, because he normally confers with them on the matter. So I expect that we'll have something shortly. I know the Governor General's office has been working on it. No, it's the board of the PBCJ. The former board, the life of the board came to an end. Ladies and gentlemen of the press, again, thank you for coming. Thanks for your participation. I want to thank my guests this morning, the Minister of Health, the Permanent Secretary in the Ministry of Health, our Chief Medical Officer, and of course, Ms. Jackson, that she came but you didn't have any questions for her. She is still available to answer your questions. I will see you next week, and have a good week. Well, hopefully we'll see you next week. Good afternoon. I think we're now afternoon, yes? Yes.
Brethren, you just leg up St. Thomas. I don't understand you, man. Oh, you can't handle more than me.
Joanne?
Say out there.
Joanne?